gut. Leaky gut, and really as it relates to autoimmune problems. We have over 50 million people walking around with diagnosed autoimmune problems such as lupus, MS, rheumatoid arthritis, Hashimoto's thyroiditis. The most common form of thyroid problems is from autoimmune, IBS, ulcerative colitis, all kinds of gut problems, joint problems, skin problems. So what is leaky gut? The small intestine, the way it's constructed, it has what's called tight junctions. That's where all the cells and lining of the intestine come together in a very tight junction manner in order to protect the inside of the body, the bloodstream, from what's coming through from your mouth and stomach. Our stomach acids should be incredibly acidic. It should be about a pH of 1 to 1.5. And a lot of people do not have good stomach acids. They're more alkaline than that, which is not good. So they're not totally breaking down all the foods. And so there are going to be foods that pass through, such as proteins and carbohydrates, pass through into the small intestine, not completely broken down into their elements. Proteins should become amino acids. Carbohydrates should become sugars. And it's the job of the small intestine to selectively look at each of these particles of food and to be able to absorb it in along with the micronutrients, which are your minerals and vitamins, in order to nourish the body. It should be a very benign, simple, non-threatening process. However, because of chronic antibiotic use, chronic medication use, and other factors, the lining of the intestine starts to get eroded as if sandpaper is wearing down that intestine. So the tight junctions start to break open, okay? And when they do, particles of food that should not be in the bloodstream start to get in. And it's the job of our immune system to look at that and say, hey, who are you? You're a foreign invader. You're gonna harm us. So the immune system has no choice but to launch an attack on these food particles and start to identify them as foreign invaders. And this is the genesis of really all autoimmune disease. Over 70% of our immune system lives in our gut, in our small intestine. So what we need to do is take action steps in order to heal these tight junctions, right? Close them back up in our intestine so that our bodies can perform optimally. We have proper digestion so that we can properly absorb all of our nutrients, both macronutrients and micronutrients. So getting back to the food test, when we look at someone's food test and we see so many different excessive spikes, this is the severe or high column, okay? This is the moderate column, this is the low column. When we see very high spikes in addition to 10, 15, 20 different spikes, that is a very strong clue and indication this person has leaky gut syndrome, also known as contact enteritis. Fancy name for, hey, the gut lining has broken open, things are getting into the bloodstream like bacteria, virus, mold, undigested foods, creating a massive inflammatory attack. So looking at the food reactions becomes such a core, foundational, integrational way to understand what do we need to pull out from this person's diet in order to unload stress on their immune system, stress off of their gut, and overall reduce inflammation. Because we know inflammation is a huge killer in the United States and really globally all around the world. The key is reduce inflammation. So give us a call, 480-363-1132. Great way to find out if you have leaky gut syndrome, food test. That will show the indication if we need to deal with putting you on a proper cycle of nutraceuticals that will literally re-glue and rebond together those tight junctions in order to help your body heal itself. Look forward to meeting you and have a great day. Thank you.